Hello, I'm Melinda King. I'm a graduate student at the University of Oklahoma. I'm pursuing a Master's of Human Relations with a focus on diversity, equity, and social justice. I would like to share some information with you around a project that I'm leading that is focused on building trust between members of the Black community and the healthcare system, especially those organizations that conduct medical research. The trust between these two groups is broken because of generations of mistrust and generations of misdeeds to the Black community at the hands of the medical community. And I will share more about that a little bit later. But why is this so important? This is important because there is a gap between the healthcare outcomes for Black families versus white families. There is a shorter life expectancy for Black families versus their white peers. There are lots of reasons for these gaps. There is physician bias. There is lack of healthcare access. There are institutional issues that are rooted in systemic racism. And another factor that impacts this gap is the lack of trust that the Black community has for healthcare systems for very good reasons. So this project's goal is to rebuild the trust so that we can help enclose the healthcare outcomes disparity gaps for Black families and save their lives. So we'll share more information as I move through the conversation, but I do need your help. Black Americans have a long-standing distrust of medical systems and medical research, and is based on numerous examples of unethical medical treatment to this community. The most mentioned example of abusive treatment for this community is the Tuskegee study of untreated syphilis in the Negro male experiment. This experiment exploited Black men in Alabama from 1932 to 1972, that is 40 years, to study the effects of untreated syphilis. When the study began, there was no treatment for syphilis. However, in 1943, penicillin became the standard treatment for this condition, yet these Black men were never given this medication to treat their condition. Now, the Tuskegee experiment is the one that's mentioned most. There are many earlier examples, and one that I will share with you occurred between 1846 and 1849 when J. Marion Sims performed gynecological surgical procedures on enslaved women without any pain medication. So he is often applauded for his work in the field of gynecology, yet those discoveries were made at the expense of Black bodies. Another story that's mentioned quite often is the Henrietta Lacks story. It's another example of the misuse of Black bodies. Miss Lack's cells were utilized without her family's consent for decades to conduct cancer research and research for a number of medical conditions. It wasn't until an article was published in 2013 that discussed the cell line. It wasn't discussing the fact that her family had not given the consent. It was discussing the cell line, that this misuse became public knowledge. These stories highlight how medical community have continued to use Black bodies to conduct research that serve other communities with no direct link to serving the Black community. You know, why does all this matter? It matters because Black lives are at stake. As you can see, the life expectancy for Black women is roughly 2 years shorter than it is for white women. And the life expectancy of Black men is over 4 years shorter than it is for white men. These gaps exist for a number of reasons, but one of the reasons is because Black families simply do not trust healthcare systems and the medical community. Very basic information of the project. The Major Partners XYZ organization is a medical research organization that has a very Eurocentric database. The goal of DNA equity is to increase trust between members of the Black community and medical research organizations, especially the XYZ company. The major stakeholders are Black community leaders, Black employees at XYZ, leaders at XYZ, and the medical community. And the project design basically is, after a year of community engagement activity, to assess if that activity increased the trust between these two communities and if that trust led to more participation in clinical trials, which means there will be more opportunities to design therapeutic solutions that impact the Black community. The anticipated outcomes of this project are increased level of trust between the Black community and the medical community, especially medical research organizations. Increased utilization of Black participants in X, Y, and Z companies' genetic product. An increased number of Black participants who consent to have their DNA utilized for medical research. And because of that increase, more medical research focused on issues impacting the Black community. And then finally, our long-term anticipated outcome for this project is a decrease in the gap in healthcare outcomes for the Black community. Okay, Melinda King back here with some final thoughts and really a call to action. Some final thoughts. Okay, Black families die earlier than their white peers. Black families have a more severe response to common medical conditions than their white peers. There are lots of issues that impact this gap in healthcare outcomes, but one of those factors is a lack of trust. And that lack of trust is based on generations of examples of misdeeds to the Black community at the hands of the medical community, especially those organizations who conduct medical research. So what's the call to action? The call to action is different for different stakeholders. For the medical community, for organizations that conduct medical research, you have to acknowledge all these misdeeds, and you have to work to reestablish trust for this community. And once you've done that, you need to encourage members of the Black community to participate in clinical trials and to participate in medical research. But when you get that level of participation, you need to use that data to create products that help to solve problems that have a disproportionate impact of individuals in the Black community. Create the drugs that manage those issues like high blood pressure and type 2 diabetes and sickle cell for the Black community. Don't take that data and use it to solve medical issues in other communities. And Black families, as hard as it is, we will have to begin to start participating in these medical research projects, and we have to start participating in clinical trials. We need to make sure we're understanding what we're participating in, which is a really big part of my project, to make sure that the informed consent process is clear. But we've got to be in there so that the medical community, the scientists, can know how specific products, how specific drugs are going to impact our bodies. So the call to action is to the medical community, it's to the Black community, it's to the XYZ company. You're going to get the data, and we need for you to use that data to help the Black community. It's for Black leaders to help us share the story of how important it is for there to be black representation in clinical trials and in medical research. This is so important. I mean, it's truly life or death situation information, and we all have a role to play. So let's get at it.